they're only doing something that we are completely capable of doing anyway. Like the human body, the psyche, the spirit is completely capable of doing that type of work. It just is facilitated by something like psychedelics, but it can also be facilitated by meditation, or it can be facilitated by holotropic breath work, et cetera, et cetera. What we want in a healthy situation, when we experience a trauma, is that, what we call a trauma, is that we want to be able to fully express the emotion physically. It's like if you have a clear glass wall and a bird flies into it, right? And it collapses, it's stunned for a second, it gets up, it shakes, it like chirps, and then it moves on with its life. Then it starts go hunting worms again. It doesn't sit there and it's like ruminating about, oh fuck, like I've got to look out for other glass now for the rest of my life. It has the experience, it shakes it off, and it moves on. In our culture, I think of 6 basic emotions. We can get into it later if it matters, but we have a cluster of emotions that we have started we've started judging as being weak, right? And to me, those are sadness, fear, and shame. It's like, if you're feeling those, they're weak, you're not a man. And so we don't get that opportunity for catharsis, right? Because we're told from a young age, boys don't cry, hide it, and so then we start locking in all of these experiences in our body year after year, experience after experience, and they build up, and that has to go somewhere. And so, what happened was that I had all this stuff, all these feelings about my dad dying, and I didn't know where to express them. I didn't have people that would listen, that could listen the way I needed them to listen. And so it built up, and then so the psyche, the unconscious, like tries to put that somewhere, right? And that somewhere sometimes is, depending on your genetics and your upbringing, looks like alcoholism, or it looks like an eating disorder, or it looks like PTSD. For me, that cluster of things at that moment in my life looked like a phobia. And I prefer to think of mental illness in these categories of just like, again, because of your unique traits, it expresses this way. But I don't believe in, like, I used to believe, but I don't anymore, that there's these like hard evidence DSM diagnoses that like are genetically predisposed and you can never be healed from them. Like psychedelics have shown me that, like almost without exception, the paradigm of mental illness that we have created is especially the categorization is a lot of baloney, and I think that we can do really deep healing by revisiting these past experiences. And so that's where psychedelics come in, right? Because psychedelics, what I'm basically saying is we need to allow the emotion and the movement to come to the surface so that we can deal with it. So I like to think about psychedelics as evocative therapies as opposed to suppressive therapies, right? Because like suppressive, you can even see that in the categories of our medications, the psychiatric medications: antidepressant, anti-anxiety. What do those say? Anti-sadness, anti-fear. If you're feeling something, numb it down. I don't want to see it, right? And we as a mental health field, like we're not even taught how to deal with increased emotions. We're taught how to suppress them. And that's where psychedelics, that is why they're so effective. Like we're seeing, MDMA and psilocybin have both been labeled, and we can talk about what this means in a second. The FDA has labeled them as breakthrough therapies, which means they get like an accelerated approval through the FDA. That's the only 2 times in history that designation has been used for a primary mental health condition. And so we're seeing rates of like 60, 70+% of people healed after 1 to 3 treatments with a psychedelic, with psychotherapy in between. And like, as well as I, that those numbers are like unheard of in psychiatry. So a good number in psychiatry is like 35%.
Yep. Yeah, so that's crazy, man. It's so interesting. So I think a lot of why we've grown is because my personal approach is like very aligned with yours. So I don't think of mental illness as an illness. Like I don't think these things are broken within people. I think these are adaptive mechanisms that have kind of gotten out of control. So the way that I understand anxiety, for example, is we all have a future functioning a capacity within our brain to predict problems in the future, right? Like that's what our brain is designed to do. And if we anxiety is simply that future problem predicting capability, like gone out of control. And like even depression or I struggle with some things like schizophrenia, which in my clinical experience have been like more like an illness. Like I have trouble seeing sort of the value of that, um, especially with some of the negative symptoms like cognitive problems and things like that. But I think for a lot of these kind of neurotic conditions or feelings of like depression or anxiety or whatever, like they're just our bodies and minds way of trying to express something, and we don't let ourselves express it. And a lot of the work that we do on stream, the reason that we kind of ask personal questions, and I think part of the reason that we've grown is that we see a lot of catharsis like on stream. So we talk to people, we sort of evoke emotions, we ask important questions, and then people oftentimes have catharsis, which I think is a good word to describe it, where they'll sort of have like this emotional moment. And the other thing, by the way, Will, just in terms of like things that we were taught, like, I remember working with psychoanalytic supervisors and stuff like that, and them talking about therapy is like a really long-term thing. Like patient had a breakthrough after like 2.5 years. And then I remember thinking as like a resident, because I'm the one who's being taught, so I'm not an expert. I'm like, what the fuck were you doing for the first 2 years? Like if they had a breakthrough at like 3 years. And one of the things that I've come to believe is that like I don't think that our paradigms, as well as like medication, I don't think that psychotherapy needs to be this long and protracted process that lasts years and years. I think that you can use certain tools. So I personally use meditation to evoke a lot of emotion, and like when you empty your mind, like whatever's down there, so you have this suppressive mechanism, right, that keeps all these emotions down, and then when you empty your mind, it creates a vacuum, and whatever's down below comes up on its own. And so that's been sort of my personal experience, and also my experience teaching meditation to my patients, is that like it accelerates the rate of therapy, which I doubt it accelerates it at the same rate as psilocybin and things like that. But I mean, I'm aligned with what you're saying. But
yeah. So a few things. I on this anxiety piece, which I've come to, and as a meditator, I think I'd be curious to get your thoughts on this. But I've started essentially grouping what we call mental illness into two places: anxieties or depressions. Because what we want to be in theory is fully present. We want to be in flow, right? I imagine that when we're engaged, like if we're on a first date and we really like the person, or if you're playing a game and you're really into it, you're not thinking about stuff, right? You're just in flow where you are. And so I like to think of anxieties as a category, meaning I'm not present because I'm living in the future. I'm worried about something. Or depression, I'm not present because I'm worried about something in the past that happened. And interestingly, I think with psychedelics, I give a lot of thought to it is, are certain psychedelics better for certain things? And we'll get to that. And I'm glad you asked that in the beginning. And I like that you mentioned meditation. I think the things that psychedelics facilitate, memories, emotions, etc., that we need to bring up to heal, they're only doing something that we are completely capable of doing anyway. Like the human body, the psyche, the spirit is completely capable of doing that type of work. It just is facilitated by something like psychedelics, but it can also be facilitated by meditation, or it can be facilitated by holotropic breath work, et cetera, et cetera.
Yeah, great.
I think those are the 2 points I wanted to make.
So first of all, I agree with you completely. So I encompass all mental illness into future oriented and past oriented, which I call worry and regret, which I mean, no surprise that it's basically exactly what you said. That because I even try to, in my language, I found that it's useful to step away from anxiety and depression because they are medicalized terms. So I use worry and regret. So if you look at like literally if so I teach a lot about this stuff. So if you guys have watched this on stream, like literally the cool thing about anxiety is that like if you look at any anxious thought, it is when your mind is not in the present, it's in the future. And some people even say, well, I have anxieties about the past. But if you really tunnel down into that, what they're really doing is something happens like, oh, I went to a party yesterday. I looked dumb, so people won't like me and won't invite me next time.
Mm,
And they'll think that
yeah.
that's like worrying about the past, but it's not real. Technically, it's not worrying about the past. If you really pay attention to your thoughts,
Exactly.
you're worried about the future consequences of a past action. And so all worry is future oriented mind and all regret is past oriented mind. And literally, if you can be in the present with your mind, anxiety cannot exist. In order for anxiety
Yeah.
to exist, you must be thinking in the future. And so part of what I think is really powerful is like people don't realize that like they think about anxiety as something that you have to, grapple with and treat and things like that. And my general approach to anxiety is twofold. One is to dig into the underlying things that make you anxious. And this kind of goes to what you were talking about like, there's a certain amount of personal stuff and there's a certain amount of like environmental stuff that causes mental illness to manifest in a particular way. So in the Eastern system of Vedic psychology, they talk about these things called samskars, which are essentially like unprocessed traumas. And that some scars manifest as particular things. They're kind of like, subconscious psychological conflicts. I think like
Yeah.
the psychoanalysts kind of had a sense of this.
Okay.
And so you can
Interesting.
kind of work on the root, or what you can actually do is change the function of your mind in the moment, which is completely ignoring the root and literally turn off the anxiety by focusing on the present. And when I work with
Hmm.
people with like procrastination and things like that, like you can sort of deal with the subconscious origin of your fears, which is a more long-term process. And in the moment, you can learn how to like literally shut off or overcome procrastination by understanding like the
Huh.
mechanism of how mind works. But anyway, I'm with you 100% in terms of like your formulations. Like I think,
Great.
and I also agree with you, by the way. And this is something I'm curious about. That one thing that I realized some time ago is that any substance that we put into our body is only capable. It doesn't create anything. It only activates things, right? So if we think about alcohol, like that activates GABA receptors. Like cannabis activates cannabinoid receptors. It doesn't create something new in our brain. It only turns off or on what's already there. And so any experience that you can have through a psychedelic, it's my belief, and this is kind of where I'm curious, that you can attain something similar through meditation. And I know that, when I talk to people who have had psychosis, had like psychedelic experiences, I can relate to them through my personal spiritual experiences, which sound very similar in some ways and also very different. I'm kind of curious, do you think that because this is something that people have sort of asked about and there's been some debate about. Do you think that anything that you can attain through meditation, you can attain through psychedelic use and vice versa?
Yes. I just want to put a footnote on mentioning something about psychosis because it's something that it just came back to me that you had mentioned. Yes. So yeah, I think we sounds like we completely agree on that. That um, you know, yeah, things are just unlocked by different experiences external to the body or internal to the body, right? Like, so yeah, we can put things in, like we can even think of that as basic as sugar and whatever we eat for meals, as you said, alcohol. I really like that way of looking at it. I haven't quite worded it that way, and yeah, I'm just trying to think of like my mind's at the same time, like, wait, can we add something that wasn't there? Um, which is interesting though, there, right? Just on a quick tangent, because like, what about sensory stimulation? Like the vision or touch can add something to us technically, right? That's external, like a trauma. So could a chemical do that? I don't know. Anyway, it's more of like maybe an intellectual topic, but